Well, as you know, many of us have been doing research looking at the outcomes for patients with breast cancer, and we're very fortunate when we can recruit several hundred or even sometimes 1,000 women to participate in a research study, but they're of course volunteers. And what we're hoping with this app is that we can collect a lot more information using very similar research questions to thousands and maybe hundreds of thousands of women all over the world who can tell us about their post-treatment experience. The app that I'm involved with focuses on recovery after breast cancer, but we're actually soliciting participation from any woman 18 to 80 years of age who does not have cancer, as well as women with breast cancer history, so that we can actually look and see how similar is the function for the women after breast cancer to women who are like them but don't have cancer. So I think there are many ways in which this app may be helpful. Number one, many women are very altruistic and are interested in participating in research but may not have easy access to it. And by completing the questionnaires that are on the app and telling us about their experience, they will be contributing to new knowledge. So that's very important. And this is actually being released as part of Apple's ResearchKit. So it is a research tool. And we actually hope other researchers will begin to use this tool as well in their work. But for the woman herself who's filling this out, there are daily surveys, there are weekly surveys and monthly surveys. She can actually chart and see how she's doing. So if she was fatigued at the end of cancer treatment and she completes this over many weeks, she may see that her energy is getting better. If she was having some mood swings early on after her cancer treatment ended, and now she looks back over the last few months, she may see that her mood has improved. And in addition, she can monitor her exercise and other aspects of her behavior that may be helpful in terms of self-monitoring and improving her health. Well, certainly, I've been working in this area as a scientist for probably 20 or 30 years, and I do know that as I publish in scientific journals or speak at meetings, and this gets disseminated in the press, or patients even searching on the web find my work, and they actually find quite a bit of solace in learning that cognitive complaints, not thinking clearly after cancer treatment, is pretty common, or that fatigue is another common problem. And they can then bring this up to their doctors and try to get help for this. And as we do research to try and learn how to improve on the management of some of these symptoms, those can be available to patients. But truly, if we have several 100,000 women participating in helping us collect data through our partnership, obviously, at Sage Bionetworks, which is the main organization that helped develop this app, we can then hopefully improve upon the recovery for patients who've had breast cancer as a diagnosis, and potentially other cancer patients as well. But this is really, I think, one of the first to collect research data, because we really want to learn how women experiencing this disease actually perhaps find ways to do better with symptoms that they're having, that they can share that information with us. There's a journaling aspect to the app where they can tell us about what their thoughts and feelings are and how they're actually perhaps helping solve and manage some of the symptoms that they're experiencing. So we see this as a community of survivors contributing to research who can, in the end, benefit potentially themselves as well as help others. here I am. I'm in the older baby boom generation where cancer is a big problem, and you know, as we age, cancer is an important problem for men and women. And most of us are growing up using these apps just like other people. Certainly it'll be a lot easier for younger folks who are doing this all the time. But you don't need to actually, you know, be having it at your side all the time. Although if you want to count your steps and see how far you walk, or if you're climbing stairs, and you know, to have some of the motivational tools available from the app, it's good if your phone is with you. And so actually, I've been able to use almost all of the research questionnaires and tools that I've used in funded research by the National Cancer Institute, Breast Cancer Research Foundation, Komen, and so forth. I've been funded by a lot of organizations to do high-level scientific research. But we've been able to put those same questionnaires, the ones that we felt were most useful in tracking outcomes after breast cancer treatment, we've been able to put those into the app in a user-friendly way so that we can collect, again, very large samples of data and hopefully have a diverse sample of participants, women of all socioeconomic status and ethnicity, to be able to contribute and help us learn. And we may learn about new symptoms or problems that we didn't know exist because they will be telling us about it. You know, I could see that in my own practice with patients, you know, when I start them on a new medication, say one of the hormonal treatments that we use for breast cancer, and I want to know if they're having any symptoms or side effects from the medication, I could ask them to complete this and bring it back in to me as a log to see how they've done. Frequently we ask people to check their blood pressure or monitor other symptoms, and this way we'd get a very accurate sense of what's really going on. So I think it could be used as a clinical tool, but I think at this point we're hoping it'll be used mostly as a research opportunity, and it will be one of those innovations that will make collecting patient-reported outcomes much easier. For me, I think what was most appealing is that when I use many of these questionnaires, I have what we call normative data or comparison data from standard populations, but they may not really be of the same socioeconomic status or ethnicity of the women who have breast cancer. And so we hope here, by having similar populations of healthy women, we can compare them directly to the women with breast cancer and really identify what's unique about what we've done in terms of cancer treatment that has caused some of the benefits and potential harms that treatment causes. I think the very special thing about this, which is unusual, is this is being created with open source software so that this could be used by other app developers and modified to be used in other settings, both for clinical care or for research purposes. For me, this is a very exciting way of translating, you know, what we've learned or done in academia out into the real world. And I think to the extent that the public understands that what we do in research can have a real meaning and possibility to transform health for patients is an important message.
you.